Hey everyone, we've got another heart today. This is number 449 in our collection, and we'll start off by doing a quick teaser preview of the main phenotypic feature of this heart. So we'll open up this heart here from the right ventricular aspect, or right atrial aspect, and here immediately we can see that there is an atrioventricular septal defect with its large atrial component and a ventricular component. Here's the superior bridging leaflet guarding the common atrioventricular junction, and that this superior bridging leaflet has connections to a papillary muscle that connects to the RV free wall here. There's no direct connections of this superior bridging leaflet to the crest of the ventricular septum here, and no connections to the right side of the septum here. It's to a papillary muscle that connects to the RV free wall, consistent with a Rastelli C. So with that being said, why don't we go ahead and take a look at how the heart would have sat in the chest. The heart would have sat in the chest roughly like this, with the anterior surface coming out towards the screen, posterior surface towards the turntable, superior head here, inferior legs here, left over here, right over here. So let's start off now as we usually do, which is by trying to identify at least externally what appears to be the right atrial appendage. And here we have an appendage that's triangular, broad-based or pyramidal in shape, consistent with a morphologic right atrial appendage. So let's go ahead and open up this appendage here. And when we do, we see pectinate muscles that spill outside the confines of the appendage, consistent with the morphologic right atrium. Here it looks like the mouth of the superior caval vein, and in fact, that is where the superior caval vein drained into the roof of the right atrium. Now, when we look at this right atrium, it appears that the oval fossa is in fact intact, and I can't pass a probe through it. But there's an intraatrial communication, or an atrial level shunt, as there is an atrioventricular septal defect here, and here is the atrial component of that. Here is the mouth of the coronary sinus. And now that we've seen that this is an atrioventricular septal defect, we know that there's a common atrioventricular junction. We can see the common atrioventricular valve here. Here's the septal leaflet with its left and right-sided components here. And we see that the superior bridging leaflet has no direct connections to the crest of the septum. And here is the crest of the septum right here. And as I lift off the superior bridging leaflet, you can see that there's no direct connections to the crest itself. And that, in fact, the connection is to this papillary muscle that arises from the RV free wall. So consistent with a Rastelli C classification. And then here is the right anterosuperior leaflet, the right inferior leaflet here, and then here's the inferior bridging leaflet coursing over the crest of the ventricular septum with direct connections to it as well. This, in fact, is a morphologic right ventricle. It's got coarse trabeculations, and here is the septomarginal trabeculation. Here's an arterial valve here with 3 leaflets, 1, 2, 3, and 3 sinuses, consistent with the morphologic pulmonary valve. And then we also can see now the ventricular level shunt produced by this AVSD. So an atrioventricular septal defect, Rastelli C, with both an atrial and ventricular level shunt. And here you can see the superior bridging leaflet once again, and here are the chordal attachments to a papillary muscle that connect directly to the RV free wall. Here's the posterior aspect of this heart now. And here we find a smooth-walled atrium consistent with a morphologic left atrium. We can now see the atrial component of this atrioventricular septal defect. We can also see the ventricular component of it. So both, here's the atrial level shunt, here's the ventricular level shunt, and here's that superior bridging leaflet coursing through the atrioventricular septal defect. So here's an AVSD, and you can see nicely now the atrial and the ventricular level shunts here. The superior bridging leaflet can be seen nicely in its alleged free-floating form with no direct connections to the crest of the ventricular septum here. So here's the superior bridging leaflet, here's the crest of the septum, no direct connections here. Here is now the left mural leaflet, and then here is the inferior bridging leaflet coursing over that ventricular septum, and it does have direct connections to the crest of the ventricular septum. So superior bridging leaflet, so I apologize, inferior bridging leaflet, and then the left mural leaflet. Sorry, this is a small heart, and it sometimes slides out of frame. And here is a ventricle with fine crisscross trabeculations, consistent with the morphologic left ventricle. This is a good view to see that, in fact, the inlet and the outlet of this heart are disproportional, with a longer outlet than inlet, also consistent with an atrioventricular septal defect, because the aortic valve is now no longer able to be wedged between two atrioventricular valves, because two atrioventricular valves don't exist. So it is sprung forward, and as such, then the outlet becomes a little longer than the inlet component. Here we see the scooped out appearance of the ventricular septum, also consistent with an AVSD. And here we see the superior bridging leaflet coursing through that defect. Then we come across our second arterial valve here, which has 3 leaflets and 3 sinuses, and you can see a coronary here, consistent with an aortic valve. And here you can see that the aortic valve is not entirely supported by muscle, which is different from the pulmonary valve, and there is in fact continuity between part of the aortic valve and the superior bridging leaflet here. So a heart with an AVSD with both an atrial and ventricular level shunt and a Rastelli C classification.